So today let's talk about how physical therapy can help relieve chronic pelvic pain. So when we talk about pelvic pain, really what I mean is pain anywhere in that abdominal cavity. It could even be going into the legs. It could be pain that's constant and there all the time, or it could be pain that comes and goes, or it could be pain that's just there with certain activities. It may be pain up into the abdominal cavity. It could be pain in the pelvis. It could be pain around the sit bone area or the low back, the sacral area. It could be pain that's present when you're sitting. It could be pain that's present just with intercourse. So all of those are common complaints that I hear and things that physical therapy could potentially help with. So if you're experiencing those types of pain, it's a good idea to first follow up with your primary care provider or specialist to rule out any major causes of pain, such as infection, tumors, all those major things. But a lot of women that I see and treat have been through the whole medical side of things. They've had every test under the sun and nothing shows up. And so they're frustrated and think that, is the pain just in my head? But they know it's not. They know it's there. And fortunately, physical therapy may be the answer to alleviate that pain. So let's kind of talk about some of the causes of pain. So one of the main reasons that women that I work with are experiencing pain is that pain is actually coming from the muscles. So the muscles and the fascia throughout our whole trunk is intertwined, and it has to work together properly and move properly in order to function and not cause pain. So unfortunately, all those tests and MRIs and things like that don't show what's going on in those actual muscles and tissues. There may just be tightness in the muscles that can cause a severe amount of pain. So definitely physical therapy can help with those things. So when you come in for an evaluation in physical therapy, what we're going to do first is just sit down and talk. I'll ask you about what's exactly going on pain-wise, what maybe some of the triggers are, how long it's been occurring, or if there was any triggering factors at the beginning of when the pain started. We'll do an evaluation and look at your posture, look at your movement through your spine, your hips, do some hands-on work just to kind of feel through the muscles and the fascia, see if we can identify where any of those restrictions are at that may be an underlying cause of your pain. If you're comfortable with it, we may also do an internal pelvic exam. So there's muscles inside the pelvis that can be a big source of pain. So definitely only if you're comfortable with that, but that can be a really helpful avenue to address. Once we've kind of identified some of those underlying causes, then we can put together a plan to address those things slowly over time to get you some relief in your pain. So another piece that we'll look at is the nervous system and what its role is in contributing to this pain. So a lot of times when you've been in pain for a long time, the nerve system can kind of get ramped up and out of control, and it's almost on high alert all the time. So part of the treatment and part of therapy will be techniques to help quiet and calm back down that nervous system so that your nerves are accurately representing what's going on in your body. So if you are experiencing any type of pelvic abdominal pain and you're ruled out any other major causes of pain, I would definitely encourage you to give me a call. We can sit down and talk about what's going on and devise a plan to get to the root of the pain and help you to get through this and have a better quality of life.